The presence of social media in contemporary society has been very prominent. Over 40% of healthcare consumers use social media platforms as a source of medical information. The medical literature has also seen an exponential increase in the number of studies that use data derived from social media coverage of healthcare related issues. My name is Ryan D'Souza. I'm currently a pain medicine assistant professor at Mayo Clinic.
My name is Hassan Murad, and I am currently a professor of medicine and researcher at the Kern Center for the Science of Healthcare Delivery.
We are excited to review our article titled "A Proposed Approach for Conducting Studies That Utilize Data from Social Media Platforms." This has impacted our healthcare delivery in many ways, including patient education and communication between patients and healthcare providers.
The literature does not describe a systematic approach on how to conduct studies that survey social media outlets and synthesize their content. Therefore, the goal of our paper was to propose a step-by-step framework for conducting studies that utilize data from social media platforms. The proposed framework consists of 6 overarching domains, focusing on framing a question that is appropriate for social media evaluation, identification of social media outlets and selection criteria of content, systematic data extraction, assessment of quality of content and sources of bias, analysis of data, and interpretation of study findings. In this video, we will briefly discuss each of these domains.
So the first domain is framing an appropriate and structured question. Now, this research question can be structured based on the PICO format, which is familiar to most researchers and is defined as a specific population, intervention, comparison, and outcome. Another strategy for structuring questions is to utilize the perspective format, which stands for perspective, setting, phenomenon or of interest or problem, environment, comparison, time, and findings. A protocol to address the study question should be developed a priori with appropriate inclusion criteria, exclusion criteria, and a hypothesis.
The next domain is to identify the social media outlet and define selection criteria. The author should determine inclusion and exclusion criteria a priori and determine relevant outlets and platforms that they are going to evaluate. In addition, relevant search terms and threshold filters for study selection should be selected.
So the next domain is to systematically extract data. So data extraction is best performed by 2 or more independent investigators to reduce the likelihood of error, bias, and subjectivity. Akin to systematic reviews, agreement among investigators should be tracked and reported.
The next domain is to assess the quality of the content and identify sources of bias. The authors should use validated instruments. The 2 most commonly utilized tools are the Discern tool and the Health on the Net Code of Conduct. We provide a list of additional validated tools in our manuscript. When evaluating social media content for accuracy, the authors should use an appropriate reference standard. Reference standards are often systematic reviews or meta-analyses on the topic or published guidelines.
The next domain is analysis of data. Certain study objectives, such as compiling a list of patient attitudes regarding a health condition, may be more amenable to a qualitative approach, whereas studies that involve appraising the quality using validated numerical tools may be performed in a quantitative study design. Content may be categorized based on the tone of content, source, intended audience, quality of information, as well as themes.
The last domain is to report and interpret study findings. In addition to providing a clear report of the data, it's also important that authors inform readers about the confidence in their findings. One tool that could be used to appraise this content is the Great Circle tool. Lastly, good social media studies should provide actionable items. These actionable items can be used in clinical practice and improve patient care. Finally, if the study reveals important research gaps, these should be emphasized and explored.
In our framework, we provide many illustrative examples to help guide authors. We hope this framework will become a standard that allows researchers to systematically utilize and report data from social media platforms. We thank you all for your attention and are happy to answer any inquiries or questions about our publication.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.